Can you hear me okay?
Yep.
Okay. I see head nods. I always have to question. I don't hear anything back. These electronics work.
So you don't get a lot of feedback, unfortunately.
Hey, Colton. Christina
yeah,
Rudis, though. Okay.
I'm seeing that.
Okay.
Okay, you should be good to go.
Great. Thanks, Colton. Well, Patsy's absent today, and so I know I won't do as well, but if you'll bear with me and I'll lead the meeting. So we'll get started. Hello, I'm Juliana Reshik, and I serve as the Vice Chair of the Education Committee of the Kansas State Board of Nursing. I ask the members of the Education Committee to respond to a roll call signifying their presence at this remote open meeting via Zoom and YouTube. Patsy Zeller, and she is absent. Andrea Watson, and I believe she is absent as well. Christina Rudisil.
Present.
Dee Barnwest.
Present.
Amy Height.
Present.
And Michelle Berdishaw.
Present.
Thanks. I ask the following board staff members to signify their attendance. Carol Moreland, Executive Administrator.
Present.
Janelle Martin, Nursing Education Compliance Officer.
She's actually absent.
Okay. And Michelle Brown, Education Secretary.
Present.
Great, thanks. Public comment allows individuals to address the Education Committee about their concerns. However, the Kansas Open Meetings Act, which is known as POMA, does not require the Education Committee to provide public comment or answer questions of individuals. Public comment will not be taken today because there is the possibility that the connection for the remote meeting may be lost over time, and the time for the meeting may not allow everyone who is present to comment. Additionally, we will not know what comments an individual may make, and we would want to provide notice to the public of our intent to discuss a particular matter so that the public may listen and observe our discussion. However, representatives from each nursing program will be allowed 5 minutes total to provide feedback when the committee discusses site visit reports and curriculum change requests for their respective nursing program. Because we are conducting this public meeting remotely by Zoom and YouTube, I state for the record the following information. On June 13th, 2022, the board sent notice of the meeting for the Education Committee to all individuals who have requested notice of the committee's meeting. Additionally, the notice and agenda were posted on the board's website, ksbn.kansas.gov. You may obtain a copy of the notice and agenda at the website or by sending an email to carol.moreland@ks.gov with the subject line, request for the agenda, and the board staff will send it to you. The notice contains the internet links to access the meeting by Zoom and YouTube. The notice also contains the Zoom telephone number to attend this meeting by telephone call. All of these electronic mediums allow the public to attend the meeting free of charge. The notice also advises individuals to contact the board's office at 785-296-2967 if they experience any technical issues during the meeting. The only mediums for interactive communication offered for this meeting are the connections by Zoom and YouTube as previously stated. Each member of the committee, board staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. Each participant to this meeting shall ensure microphones, phones, or electronic devices are on mute when the participant is not speaking. Each motion will be clearly stated before the committee votes, and the vice chair will announce the results of the final vote. A statement or motion will clearly identify and authorize by delegation each member of the committee or staff who will be permitted to sign any document on behalf of the committee. The meeting is being recorded, and the recording will be posted to the board's website. The committee has the following items on its agenda: call to order, review of on-site packet, additions or revisions to the agenda, announcements, approval of minutes for the meeting held in March of 2022, nursing education compliance officer report, executive session if needed, site visit reports, new business, unfinished business, petitions, agenda for the committee meeting in September of 2022, and adjournment. The above list of agenda items includes an executive session. If the committee elects to exercise the option to go into executive session, the committee will follow this process. First, the committee must be in open session before going into an executive session. Then a motion will be made and seconded. Pursuant to KSA 75-4319B, the motion must contain the statement of justification, for closure, the subjects to be discussed, and the time and place that the open meeting will resume. If a motion for executive session passes, public will be excluded from this portion of the meeting, and the executive session will be conducted by electronic means that will not be made available to the public. The committee members will return to the open meeting after the executive session. The open meeting will resume when the committee members return to the Zoom and YouTube meeting after the executive session. The complete motion for an executive session will be recorded in the minutes. The meeting is now called to order, and the committee will now consider the next item on the agenda. So we will review any on-site packet.
There is no on-site packet.
Okay, perfect. Thanks, Carol. So any additions or revisions to the agenda?
Not that I'm aware of.
Okay, thank you, Carol. So any announcements? Okay, hearing none, we'll move on to approval of the minutes from March 29th. Did everybody get a chance to look over those?
This is Michelle Bershaw. Motion to approve.
Thank you, Michelle.
This is Christina. I'll second.
Thank you, Christina. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Motion carries. Okay. Nursing Education Compliance Officer report. Carol, can you help us with that?
Yeah, Carol Moreland, administrator. I'm actually filling in for Janelle today, so hopefully I'll do everything right. See if it comes back from years ago. But anyway, Janelle's report starts on page 13 in your packet. I'm not going to go through all of it. Just the nursing program updates. North Central Kansas Tech College in Hayes has announced their full-time director of nursing, and that's Sherry Stone. Salina Area Technical College announced that effective July 1st, Friday, Randy Kirk has been named the new director of nursing. Butler Community College announced that effective May 1st of 2022, Janet Schuler has been named the new associate dean. And then one program has lost a director, that's Rasmussen. They are without a director in Kansas. They have an interim one helping in. And then we were just notified from Pratt that they will be closing their PN program effective June 30th, 2022. So Thursday, they will close that PN program. And then not going to go through like all the rest of that. The reminders that are on page 15, the annual reports are due by June 30th at midnight. So if you don't have that submitted yet, please make that a priority. Janelle is tentatively planning to have the program administrator orientation and update on September 12th in Topeka if the board decides to meet in person. So that will be decided tomorrow, I believe. And then the virtual Nclex conference is going to be Thursday, September 22nd. That's NCSBN's. And it is virtual this year. So she's got the link there if you want to register to attend that. Other than that, I'll just kind of let you read the rest of it. Thank you.
Thank you, Carol. Okay. We'll move on to our site visit reports. So start with the Barton Community College ADN program.
Yeah, this is Carol Moreland, administrator. And just as a reminder to the committee, the program administrators and maybe other representatives from the program are available to be brought over if you have questions or something. It's my understanding typically we do not bring them over, but they are available if you have questions. So the first one is Barton Community College ADN program. That site visit was done on February 28th and March 1st. The site visitors were Patricia Zeller and Janelle. And that actually starts on page 16 in your packet. And then going to page 25 is actually the strengths and all of that. Strengths, strong support of the nursing program from top administration down to support departments at Barton Community College. Number 2, faculty work as a team and are very supportive of each other and the students. Number 3, faculty feel very encouraged and supported in their teaching roles and the availability of resources. Number 4, new onboarding process for faculty at Barton Community College that was majorly influenced by the nursing department onboarding process. Number 5, strong clinical site support for the ADN program. Number 6, strong mentoring of nursing faculty and nursing program director, as well as support for professional development. Number 7, students would highly recommend the Barton ADN program and say that faculty are the greatest strength of the program. Number 8, solid curriculum with good Nclex pass rates. Some opportunities. Number 1, clarify the language in the AVC contract to make sure regulatory standard is addressed. Facility needs to maintain responsibility for patient care and staff independently of student assignments. Number 2, clarify the 2 contracts that currently state faculty staff evaluate student performance. Facility staff evaluate student performance. Faculty is responsible for evaluation and grade assignment. Facility staff and preceptors can give feedback on student performance. Number 3, syllabi currently state credit hours for the course, but do not break down theory and clinical hours in the combined courses. Syllabi should state theory, credit hours, and clinical credit and clock hours. Clinical hours should also identify observation hours, simulation hours, and precepted hours. So the recommendations that are on page 26 in your packet. Number 1, review and update the 3 clinical contracts that do not fully meet regulation. If language is in the contract, highlight and send to the Education Compliance Officer by September 30th of this year. If appropriate language is not there, revise the contract and send the update and the addendum to the Nursing Education Compliance Officer by September 30th of this year. And then number 2, recommend reapproval of the ADN program for a time period of national accreditation. And just whenever you're ready, Michelle does have motions and stuff.
Any questions or comments from the board? Okay. Michelle, I think we'll.
Is there oh, sorry.
Go ahead. Go ahead. Sorry, I apologize.
Is there a committee member that would like to make the following? I move to accept the site visit report for Barton Community College ADN program with recommendations and reapprove the ADN program for a time period of national accreditation.
This is Amy Hyde. I'll make the motion.
Thank you.
Dee Bonenblust, and I will second that motion.
Thank you, Dee. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries. Okay, Barton County Community College PN program.
Yeah, this is Carol Moreland again. Barton Community College PN program, that site visit report starts on page 27 in your packet. This site visit was done the very same time as the ADN, so February 28th and March 1st. Patricia Zeller and Janelle actually, of course, did that one also. So the strengths and everything start on page 37 in your packet. The strengths, a lot of these you're going to hear from, what you heard with the ADN. Number one, strong supportive nursing program from top administration down to support departments at Barton Community College. Number two, faculty work as a team and are very supportive of each other and the students. Number three, faculty feel very encouraged and supported in their teaching roles and the availability of resources. Number four, new onboarding process for faculty at Barton Community College that was majorly influenced by the nursing department onboarding process. Number five, strong clinical site support for the PN program. 6, strong mentoring of the nursing faculty and the nursing program director, as well as support for professional development. Number 7, students would highly recommend the Barton PN program and say the faculty are the greatest strength of the program. Number 8, solid curriculum with strong Nclex pass rates. Couple of opportunities were identified. Number 1, clarify the 2 contracts that currently state facility staff evaluate student performance. Faculty is responsible for evaluation and grade assignment. Facility staff and preceptors can give feedback on student performance. Number 2, syllabi currently state credit hours for the course, but do not break down theory and clinical hours in the combined courses. Syllabi should state theory credit hours and clinical credit and clock hours. Clinical hours should also identify observational hours, simulation hours, and precepted hours. So the 2 recommendations are, number 1, review the 2 clinical contracts that do not fully meet regulatory language and send the update and addendum to the Education Compliance Officer by September 30th, 2022. And number 2, recommend reapproval of the PN program for a period of 5 years.
Okay, any discussion? Okay, Michelle.
Is there a committee member that would like to make the following motion? I move to accept the site visit report for Barton Community College PN program with recommendations and reapprove the PN program for 5 years.
This is Christina Rudisell. I'll make that motion.
This is Amy
Michelle.
Hyde. I'll second.
Thank you, Amy.
Sorry, Michelle.
Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries. Okay, Barton Community College with their initial visit for the ADN satellite.
Yeah, this is Carol Moreland again, and this report starts on page 38. And if you remember, I believe the last meeting, they brought a request forward to have a satellite program at the Pratt Community College campus. And so Janelle and Rebecca Sander went out and did a site visit on April 27th. And their strengths and everything starts on page 44 in your packet. Strengths that they identified: very strong support from administration and good collaboration with the Pratt Community College administration and staff. Number 2, extensive experience with online and satellite programs and education. Number 3, strong communication between nursing program and the support services for the program. Number 4, clinical sites available and excited to offer clinical to the Barton Community College satellite program. Barton Community College Director of Nursing Education has had contact with all clinical sites with current Pratt contracts and has also visited new sites with 2 new contracts. Number 5, have hired a full-time faculty for the Pratt campus that will start in July. Number 6, strong faculty support from Barton Community College current nursing faculty, very involved in planning and implementation for the satellite campus. Number 7, already have strong online library resources for other satellite programs. We'll add nursing resources that aren't currently available. Number 8, nursing advisor from BCC has already done outreach to all current Pratt PN students who have an interest in ADN program and to all current inquiries regarding the new satellite program. Number 9, Pratt campus simulation and lab facilities. The simulation hospital setup, 2 new simulators for use, extensive supplies, current BCC simulation faculty already working with the facility. There was one opportunity identified, and that is the opportunity for collaboration between librarians to understand resources available on both sides, and if there will be any collaboration if determined to be, and will be any collaboration if determined to be of value. 2 recommendations. Recommend approval of the satellite campus for Barton Community College ADN nursing program with permission to admit up to 30 students annually in the fall of each year, beginning in 2022. And then number 2, a follow-up visit for the satellite campus to occur with the next planned site visit for the current BCC ADN nursing program.
Any questions for Carol? Okay, Michelle?
Is there a committee member that would like to make the following motion? I move to accept the initial site visit report with recommendations for Barton Community College ADN program for a satellite campus at Pratt Community College and approve to admit 30 students annually beginning fall 2022 with a site visit to occur with the next planned site visit for Barton Community College ADN program.
This is Michelle Burdishaw. I make the motion.
You, Michelle?
This is Dee Bonenblust, and I will second that motion.
Thanks, Dee. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries. Okay, Rasmussen University ADN program.
Okay, this site visit, this is Carol Moreland. This site visit report starts on page 45. And this is Rasmussen University's ADN program. This was done on March 8th through the 10th of this year. The site visitors were Christina Rudisell, Michelle Burdishaw, and Janelle Martin. And so strengths and opportunities and recommendations start on page 55 in your packet. Strengths that were identified: number 1, strong and passionate faculty. Number 2, dedicated clinical sites in Topeka and Kansas City. Number 3, strong support for students, faculty, and administration. Number 4, dedicated clinical coordinator. Number 5, extensive library resources. Students feel resources are amazing. Number 6, tutors on site, both peer-to-peer and professional. Number 7, together all 24/7 mental health wellness services. Number 8, students feel faculty are very available and supportive of student success. Number 9, students feel the program does a good job of getting clinical experiences. Number 10, nursing resource guide is a great resource for students. Some opportunities that were identified: number 1, more direct clinical time. Simulation hours are high. Students like the hands-on experiences rather than the online virtual. Number 2, differentiate clinical hours between simulation, lab, observation, on syllabi and on the clinical schedules. Number 3, the lab ratio is currently 1 to 16 faculty to student ratio. Number 4, Nursing Advisory Council could be really rich resource, possibly meet more than annually and add members from strong clinical sites. Number 5, include general education faculty in discussion with nursing faculty to understand the needs of nursing students better. Number 6, tracking for tutoring to assure students are getting help when they reach out. Number 7, test process and policy is verbalized, but not written or part of the nursing faculty handbook. Number 8, Nclex pass rate below Kansas standard for past 2 years. Consider analysis and improvement. The 4 recommendations that are made. Number 1, develop an Nclex improvement plan as needed to maintain Nclex first-time pass rates above the regulatory standard. Just a reminder, the standard will be 80% beginning with 2022 rates. Submit the plan to the KSBN Education Compliance Officer by September 30th, 2022. Number 2, process to ensure all KSBN required documents, including are submitted timely and kept current. Higher exceptions must be done on an annual basis for faculty that do not meet requirements. Submit process documentation to the Education Compliance Officer by September 30th of 2022. Number 3, develop a written test process and policy for the nursing faculty handbook. Submit to the Education Compliance Officer by September 30th, 2022. And number 4, recommend reapproval of the ADN program for a time period of national accreditation if all recommendations are completed in the given timeframes.
Any questions?
So this is Dee Bonenblest, and I have a question for Carol. Carol, if you would just clarify with me, I see that on number 4, it says that, certainly recommend reapproval if all recommendations are completed. So what happens? I mean, I'm assuming all recommendations will be completed. Could you just clarify how that would work if some of them are not?
This is Carol Moreland, and well, the way this is written, I believe probably what will happen is they will be notified that they've been reapproved as long as they get all the recommendations in. Now, I'm sorry, I do not know. Michelle or Janelle may already have these recommendations in. I don't know. Sometimes they send them in fairly soon afterwards. But I would just think that it will be very clear to them that they will not be reapproved if these recommendations are not completed in the timeframes. And I presume maybe that was discussed with them at the site visit. I don't know if Christine or Michelle can expand on this.
This is Christina, and yeah, I do believe it was discussed, if my memory serves me correctly. And I don't know, Michelle, I think there was that some of the recommendations, I think it was because it was a repetitive recommendation, if I remember correctly.
Correct. And the pass rates were consistently low. And so one of the discussions that we had were, if this next year in 2020, if they do not meet the requirement of maintaining above the 80%, then that would be a concern and would not have met standard. Is that what you understood too, Christina?
Yes, that's what I understood as well.
And I guess my only concern is that they've now had a change in their dean or lost their dean as well. So that's a concern, but they have strong faculty too, and strong, and dedicated, passionate faculty. So we're hoping that they can continue to succeed. So.
This is Carol Moreland, and I think an option that the committee would have is to hold their reapproval notification and everything until they get that in, all of those things. You could certainly put the motion that way if you wanted to. Does that answer your question, Dee?
Yes, it does. And I appreciate the discussion. Thank you, Michelle and Christina, for that clarification.
This is Christina Rudisill. I really like your suggestion, Carol. I feel like that would give me a little more comfort until we can confirm that either they've already been sent in or that they do get sent in, and then we can discuss it again in the September meeting. Can we change that motion, Michelle? I'd be happy to give whatever motion you want to write down.
Yeah. If you would like to make one, I will write it down.
I would like to make a motion that we hold reapproval until the September board meeting when documents can be confirmed that they have been received. Does that make sense?
That does make sense, Christina. Is there a second for that motion?
This is Dee Bonnebless, and I will second that motion.
Great. Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries.
So this is Carol, and I just have a question. So you want this put on the agenda for September and kind of a report back from Janelle? Is that
Yes,
what you're
please.
wanting?
Yes. please.
Okay. All right. We can do that. Thank you.
Thanks, Carol.
Uh-huh.
Okay, Mid-America Nazarene University, their BSN program.
Okay, this site visit report starts on page 56, and this is Mid-America Nazarene University BSN. This site visit was done virtual. It was done April 6th through the 8th with CCNE, and the visitors were Amy and Janelle. And actually on page 66 is the areas of strength and the rest of that. So areas of strength. Number 1, consistent recognition by university departments and community of the capabilities of the graduates, which either meets or exceeds the community standard. Number 2, recognition of a high level of achievement in meeting program outcomes. Number 3, dedicated to the university and the program mission. Number 4, library nursing resources. Number 5, excellent reputation with leading hospitals in the Kansas City metro area, which leads to increased clinical access for students. Number 6, general education faculty very aware of the nursing program and give kudos for high retention rates and persistence of students in the nursing program. Number 7, dedicated student support for technology. Number 8, strong Nclex pass rates with a high retention of accepted students. Number 9, nursing faculty are active on the university committees. 3, faculty serve on the academic affairs cabinet. They're eager to use new technologies, implement course design strategies on Moodle, and the School of Nursing faculty participate in the book study departments and faculty involved in strategic plan, and nursing faculty well respected on the campus by administration and other faculty, very committed to helping students succeed. Some opportunities or challenges. Number 1, test process and policy, part of nursing faculty handbook. Recommend adding information about test development and item writing. Number 2, syllabi are not always uniform in the information presented. Not clear for combined courses what the hours are for didactic versus clinical time. Every syllabus should have the credit hours for combined courses, the breakdown for theory and clinical. Clinical syllabi were not available to review for the traditional BSN. Clinical schedule reviewed for 2 of those courses. Number 3, preceptors need orientation to specific courses they precept. Need to show understanding of preceptor, student, and faculty expectations with a signed document stating this has been done. Also need course name and number of preceptor info sheets. The two recommendations then. Number one, a written plan that includes the method of selection for obtaining preceptors, a preceptor job description, has the roles of preceptor, students, and faculty outlined, along with methods of contact between faculty and preceptors during the preceptorship. Should also include an orientation plan for the preceptor with information about factors that influence the student-preceptor relationship and has course information. Written acknowledgement signature from the preceptor regarding orientation, along with information about the preceptor. Course title and number they are preceptors for, license information, and areas of expertise. Submit this information to the Education Compliance Officer by September 30th, 2022. Number two, recommend reapproval of the traditional BSN and the accelerated BSN programs for a time period of national accreditation, which would be 10 years.
Any questions? Okay, Michelle?
Is there a committee member that would like to make the following motion? I move to accept the site visit report for Mid-American Nazarene University Traditional and Accelerated BSN Program with recommendation to reapprove the BSN program for a time period of national accreditation.
Madam President, this is Dee Bonenblest, and I so move.
Thank you, Dee.
This is Amy Hyde. I second.
Thank you, Amy. Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries. Okay, Highland Community College PN program.
Okay, this is Carol Moreland, and this report starts on page 67 in your packet. This was to Highland Community College Tech Center PN program. It was done on April 12th and 13th. The visitors were Michelle Bertashaw and Janelle Martin. And then the strengths and everything start on page 78 in your packet. Strengths: supportive faculty and engaged program director. Students feel faculty were available and very supportive. They feel like they have one-to-one time with faculty and like the small class sizes. Students felt like admission process was straightforward, all questions were answered, and they liked the affordability of the program. They have an engaged community advisory committee, and their IT is supportive to students, will even navigate personal laptop issues with students. Some opportunities identified: direct clinical hours, simulation, lab, observational experience hours should all be broken down in the syllabi. Number two, recruiting qualified faculty. Number three, work on Wi-Fi connectivity for students. Number four, consider administrative support for the program director. If she had more support, she may be able to recruit faculty and more students. And then faculty meeting minutes, would like to see follow-up on action items clearly articulated in the faculty meeting minutes. Would like to see the program evaluation plan items correlated into the faculty meeting minutes. Currently, it is not clear how the use of the program evaluation data is being used for ongoing program improvement. There is a program evaluation plan with evidence that faculty are engaged in the process. So there's three recommendations. Number one, direct clinical hours, simulation, lab, observational experience hours should all be broken down and shown in the syllabi. Send evidence of these changes to the syllabi to the Education Compliance Officer by September 30th of 2022. Number two, need to have scheduled maternal child clinical time in NUR 168. As a reminder, no more than 50% simulation. Please submit evidence of clinical rotational calendar for the next PN class to the Education Compliance Officer by December 31st of 2022. And number 3, recommend reapproval of the PN program for 5 years.
Thank you, Carol. Any questions? Okay, Michelle?
Is there a committee member that would like to make the following motion? I move to accept the site visit report for Highland Community College PN program with recommendations and reapprove the PN program for 5 years.
This is Michelle Berdashaw. I move.
Thank you, Michelle.
This is Christina. I'll second.
Thank you, Christina. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries. Okay, Barclay College.
Now, this is Carol Moreland, and this site visit report starts on page 79. If you remember, they brought a request forward last meeting to start up a BSN program. So this was the initial site visit to get approval to start up that program. And it was done on June 2nd and 3rd, and the visitors were Rebecca Sander and Janelle Martin. So on page 86 in your packet is where the strengths and everything start. The president is very involved and supportive of the nursing program. 2-3 years of program budget already paid for by fundraising efforts, which is ongoing. There's a great response on clinical partnerships with facilities committed, already contracted to support the program. Very thorough and thoughtful research process to build a strong curriculum and overall program. Faculty Minutes uses a strong template with well-documented research and decisions. Strong support for the nursing program from Barclay administration. VP for Academic Services, very involved and working closely with the current School of Nursing Dean and faculty. The closest BSN program is 90 miles away. Barclay fills a void in the current demographic. Strategic plan includes new faculty that would house nursing, a new facility, that would house nursing in a new space with expanded lab and simulation opportunity. So the opportunities identified, put the breakdown of clock hours on clinical syllabi, identifying observation hours, simulation hours, and precepted hours, as well as total credit and clock hours for clinical courses. Review the contract language on VC contract for appropriate language for facility retaining responsibility for patient care and being staffed independently of student assignments. Continue to look for opportunities for mental health clinical outside of Larned State Hospital observation. Clarify student testing policies to be clear on rounding issue. How final grades calculated must have 80% average on all unit tests before assignment grades factored in for the final grade and the grading scale. Identify opportunities for population health clinical experiences that meet the objectives. So 2 recommendations. Recommend approval for initial admission of 18 students per academic year to the BSN program at Barclay College. And number 2, a follow-up site visit after the first graduation.
Thank you, Carol. Any questions?
This is Dee Vaughn and Bless, and the question is the 18 students would start fall of 22?
We might have to bring Kim Henson across. Can we do that, Colton? I'm sorry, I do not know the answer, Dee.
Okay.
But we can bring, Kim Henson is their director of nursing. And is she over there, do you think?
This should be on the way.
Okay, thank you. She can probably answer that question better than I can.
Assuming they're actually there, I guess.
Okay.
Yep, there they
It
are.
looks like Kim's coming across here. Are you there, Kim?
Yes, good
All
morning.
right. Did you hear the question?
I did. The first cohort, we would start students no sooner than fall of 2023.
Okay, thank you.
Yeah.
Any other questions now that we have Kim here with us too?
This is Christina Rudisill. Do we need to make a modification of the motion to show that? Or is it okay with just us understanding it?
You certainly can modify the motion if you want to say academic year 2023. That's what you're saying, right, Kim? Okay.
Yeah, I can do that. Is there a committee member that would like to make the following motion? I move to accept the initial site visit report for Berkeley College BSN program and approve to admit 18 students per academic year starting fall of 2023 with a site visit to occur after the first graduation.
This is Dee Bonenblest, and I will make that motion.
Thank you.
This is Amy Hyde. I will second that motion.
Thank you, Amy. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries. Okay, now we've got some follow-up to the Colby ADN site visit.
Yeah, this is Carol Moreland again. And there was a site visit done at Colby on their ADN program on February 15th through the 18th of 2021. And the visitors were Patricia Zeller, myself, and Janelle Martin. One of the recommendations that came out of it was to recommend that the ADN program remain on conditional approval until the Nclex first-time pass rate is above the regulatory standard for at least 3 consecutive years. We'll reevaluate the approval status March 2022 when the Nclex rates for 2021 are approved by KSBN. There were other recommendations, but they haven't met all of the other recommendations. So we're bringing this back because if you see on page 92 is their pass rates. And for the last 3 years, 2019, it was 83.33. 2020, it was 77.78. And 2021 was 85. And all of those years, remember our standard was 75. So we're bringing this back for you to consider taking them off from conditional approval and just giving full approval since they have met that last recommendation.
Okay. Any questions? Okay, Michelle, do you have a motion proposed?
I do. Is there a committee member that would like to make the following motion? I move to accept the recommendation from Colby Community College ADN program to remove conditional approval and return to full approval with the next site visit to occur at the time of national accreditation if no further problems occur.
This is Christina. I'll make that motion.
Thank you, Christina.
This is Michelle Berdishal, second.
Thanks, Michelle. Any discussion? All in favor signify by saying yes.
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 Any opposed, same sign. And any abstentions? Motion carries. Okay. It's about 9:20. how are you all feeling? Do we need a break, or do you want to continue strong? No break, Christina? Okay. Keep going. Okay, we'll move on to our major curriculum change request. Barton Community College, the ADN program.
Yeah, this is Carol. Just a reminder, what we do on the major curriculum change request is we bring, like it's typically their program administrator across and let them actually present on it. So do we have Renee Skelton out there someplace? They typically can explain it a little bit better than Janelle and I.
They should be over soon.
Okay, thank you. Here she comes. Are you there, Renee?
Sometimes it takes
There.
a second to load.
Yeah, I
There we
couldn't
go.
get
We
it
hear
to
you.
unmute.
Okay, we can hear you now. So do you want her to go ahead and present on her major curriculum change request? Okay, Renee.
I don't have any video. Here we go. Okay,
Yeah.
so for our major curriculum change, the faculty that teaches the Nurse 1264, which is our RN Leadership and Management course, this is a 2-hour no clinical leadership and management course. And they felt like this kind of course lended itself to being in an online format. They use a lot of journal articles and different things that students can read and respond to, legal issues, delegation issues, things like that. So the faculty actually brought it to me and made a very strong case for it. So the faculty actually put together the table that you see in the packet that describes what they're currently doing, what the proposed leadership and management class would look like. They have also decided to go OER with this course. So they're moving it from face-to-face to online and OER. Barton Community College has kind of an extensive process for turning a class into an online course. So the faculty have been working with our Center for Excellence to develop a robust online course, and they've met the marks for our internal process as well. So what questions does the board have for me? Okay. Well, that was easy.
Thank you, Renee. Michelle, do you have a motion for us?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request for Barton Community College ADN program to change NURS 1264 RN Leadership and Management from face-to-face to an online format.
This is Christina Vertisell. I'll make that motion.
Thank you,
This is
Christina.
Michelle Burdish, I will second.
Thanks, Michelle. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries. Okay.
Thank you.
I might let
Renee.
keep us on who exactly is representing. So Benedictine College.
Yeah, that should be Dr. Jackie Harris and perhaps some faculty with her. We'll see if she's out there. And that actually is on page 106 in your packet, and they actually have 2 requests.
I'm sorry, you said Jackie Harris?
Yeah, that's who's on my list is Dr. Jackie Harris and 3
Maybe it's
faculty
under
that should be.
doctor.
Should be on the same Zoom from Benedictine.
Ah, I see now. They raised their hand and I'm just not paying attention. Took them out of alphabetical order.
Dr. Harris,
All
are you
right.
there?
Yeah, I'm here. I finally got through. Okay. The first thing
Great.
I'd like to do is we have a revised program philosophy, and you can read about that in the packet. We are working on some major curriculum revision to implement the AACN new essentials. And so I was here at the last meeting. We started with our mission statement, and we are kind of working our way through. The second item, do you want to wait and discuss each item separately?
I think it's fine to go on and discuss them together.
Okay, all right, great. So the second item we have is to decrease our credit hours for our nursing 3210 class, which is our Foundations of Nursing Practice and Clinical, based on feedback from lots of stakeholders. We also have kind of this weird conversion for that particular class compared to the rest of our credit hours. So we want to make that consistent. But basically what that means is we're going to go from 157.5 clinical hours down to 135 clinical hours.
Okay. Any questions for Dr. Harris? Okay. Michelle?
I'm going to start with a motion for the NURS 3210 Foundations of Nursing Practice. Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Benedictine College to decrease credit hours for NURS 3210 Foundations of Nursing Practice Clinical from 157.5 clock hours to 135 hours.
This is Michelle Burdishaw. I'll make the motion.
This is Amy Hyde. I will second.
Thank you. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries. Michelle, the second motion?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Benedictine College to revise the nursing program philosophy.
This is Dee Bonenbless, and I will make that motion.
Thank you, Dee.
This is Christina Rudisell, second.
Thanks, Christina. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries. Thank you very much, Dr. Harris.
Thank you.
Good day. Bethel College. Carol's.
Yeah, and Colton, we should have like Sarah Massam and Becky Bartell. And they have two requests also, and the first one starts on page 113 in your packet.
I'm not seeing Becky, but I did find.
She's with
Becky's
Oh,
with
there.
her.
Gotcha.
Becky's with her.
me together. All right.
Okay, Sarah.
So we do have two different requests for two different courses, or a new course and then a change to another course. So we'll start. The first one is the request for an addition of a dose calculation class. What we currently have is a process where our dose calculation is spread out through our entire curriculum, and it's taught at the beginning of each clinical course. We have 4 clinical courses. And what we're finding is, one, there's just not enough time for us to thoroughly go over what is needed to go over before we are given sort of that students kind of want to get into that clinical setting. And so there's a bit of a rush to get through content, which we don't find that seems to be more stressful. And so our proposal is to add a 1 credit hour dose calculation class at the beginning of our curriculum during that first semester. This will be a course then that runs throughout the entire first semester for students, so that we can devote the time to what we feel is important for dose calculation, as well as eliminate the need for those continual high stakes tests all the way throughout the year. And that would be added again, like I said, in the first semester. So that's our first proposal. Do we go into the second one? Is that okay?
Sure, that'd be great. Thanks.
So the second proposal is regarding our pharmacology courses. So currently what we have are 3 1 credit hour pharm courses. So first, second, and third semester. And what we're finding again is that one of the challenges when you have a 1 credit hour class is it meets 50 minutes a week. And so when we're talking about pharmacology and pharmacology testing, we do have standardized testing policies. And so as far as the number of questions and the time and all of that, and we're finding it very rushed, and we're not giving students the adequate amount of time. So our proposal is to take our 3 credit hour individual Pharm 1, 2, and 3 and morph them into two credit hour courses that would happen in the second and third semester. So we are increasing overall our pharmacology total from 3 credit hours to 4, but we're spreading it a little bit. We're just slicing the pie a little bit differently. And so it would be a 2-hour course in their second semester and a 2-hour course in their third semester. So again, we would be adding a credit hour from what we currently have. So those are our 2 proposals.
Thanks, Sarah. Any questions? Okay, Michelle?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Bethel College to add a new 1 credit hour nursing dosage calculation course to the curriculum.
This is Dee Bonenbless, and I will make that motion.
Thank you, Dee.
This is Amy Hyde. I will second.
Thanks, Amy. Any discussion? All in favor, signify by saying yes.
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 Any opposed, signify by saying no. Any abstentions? Motion carries.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Bethel College to replace Pharmacology 1, 2, and 3 courses, 1 credit hour each, with 2 credit hour pharmacology courses.
This is Michelle Burdishaw. I'll make the motion.
Thanks, Michelle.
This is Christina Rudisell. I'll second.
Thanks, Christina. Any discussion? All in favor, signify by saying yes.
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 Any opposed, signify by saying no. Any abstentions? Motion carries. Thank you very much, Sarah. Appreciate your attention to medication safety. Okay, Washburn University.
Yes, we should have Dr. Jane Carpenter and Dr. Bobby Mansfield. I think they're going to be together by the notes that I have. There's 2 requests for Washburn University, one for their graduate and one for all nursing programs. And they start on page 127 in your packet.
I think I found them.
Okay. Yep. There she is. There they are. Okay, great.
Good morning. I've got Dr. Mansfield. Colton, Tracy Davies may also be on. Tracy's the program director for the Psych mental health program. Thank you. I have Dr. Mansfield, our Associate Dean of Graduate Programs with me. We have two proposals for you. Our first one is for our Psych mental health program. As part of the new AACN Essentials, we have done a review. We have updated our inter-program outcomes for the post-grad certificate. We've updated course descriptions, course outcomes, and then we've re-looked at how we can help students move through the program and add some flexibility, because we all know our nurses are working really hard out in the community. So we've combined several of our clinical courses in new 852 and 856 into a new 857 and added a clinical hour there. And then our old 858, which was our final course, will go to 859 and it will have a decrease in hour. The other thing that we're doing with those courses is we're making the clinical hours variable. So it adds that element of flexibility. If a student has a very busy semester with life, with work, they can maybe take one credit hour for clinical and then pick up the other hours required in the next semester. So that gives them a lot more flexibility in being able to move through the program. We also looked at our didactic courses and made the prereqs, the first two courses in the program, 826 and 828, but then we gave them the ability to take the didactic courses in whichever order that works for them, because we only teach them once a year. So those are the changes in that program. Our second proposal is a change in our mission statement. Again, as like Dr. Harris mentioned at Benedictine, we're also working on incorporating the new AACN Essentials, and we also started with our mission statement. And so the faculty voted to throw out the old one and start with a new one. And so what we have for you is our new statement, and we'll be moving forward with a philosophy in the near future, but that is the next step for us. So those are our two changes. Any questions?
Thank you, Dr. Carpenter. Michelle?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from University to change the psychiatric mental health nurse practitioner clinical courses to a variable credit hour structure with new course numbers and updates and course titles, course description, and course outcome.
This is Amy. I'll make the motion.
Thank you, Amy.
This is Michelle. I'll second.
Thanks, Michelle. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries. And one more.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Washburn University to adopt the new mission statement.
This is Christina Rudisell. I'll make that motion.
Thank you, Christina.
And this is Dee Bonenblest, and I'll second that motion.
Thank you, Dee. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries. Thank you, Dr. Carpenter.
Thank you.
Baker University.
Yeah, Colton, we should have Dr. Libby Rosen out there someplace. And actually, their major curriculum change request is on page 140 in your packet. There she is.
Hi, I'm Dean Libby Rosen.
And I'm Tammy Heine. I'm the program manager here at Baker University. Okay, so the major curriculum change that we were proposing is changing our clinical hours from 67.5 hours, which was 1.5 credit hours for our mental health program, to 45 credit hours, which makes it a 1 credit hour clinical course. We felt like there was some redundancy with just putting in hours that wasn't really significantly changing the meeting of the outcomes. And we felt like we would do some investigation of other schools in the area, and regionally we found that almost every other school in the area does have a 1 hour clinical course for mental health. So we decided that that would be good for us. And we've got wonderful placements for them for their clinical experiences. And we feel like we meet it across the age continuum as well. We've got good adult experiences. We've got a really good children's unit at Stormontville West. And then we also have a good population health through Vallejo. So we've met kind of all of our areas of that clinical.
Any questions? Okay, Michelle, do you have a motion for us to entertain?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Baker University to reduce the credit hours in NU 393L Nursing of Person with Mental Health Alterations Clinical Course from 1.5 to 1 credit hour.
This is Dee Bonenblust, and I will make that motion.
Thank you, Dee.
This is Christina Rudisell, I'll second.
Thank you, Christina. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries. Thank you very much.
Thank you.
Thank you.
How about University of Kansas? I think we have 2 for the BSN program.
Yes, we do. Colton, it should be either Dr. Cynthia Teal or Allison Luckenbach. I think it could be, oh, here's Dr. Teal. Okay, maybe she's the one. She was
Awesome. And real quick, Michelle, bring your mic just up a little bit. It's having trouble picking you up. Perfect.
So here's Allison Luckenbach. And she was going to be the one today to introduce our change item. But hi, I'm Cindy Teal. Nice to see everyone.
Hi, I'm Allison Luckenbach. I'm the BSN program director. Dr. Teal had a meeting that she thought she had to get off for at 10, but is not indeed. So I'm prepared to present as these changes are for the BSN program. First, we have a change in our program objectives, mainly to change from the terminology of clinical reasoning to clinical judgment as we move forward with next gen Nclex and the new essentials. So that is one major curriculum change. The second major curriculum change we would propose is for Nurse 331. It is our assessment and clinical skills course, and the faculty would like to move from having 2 hours didactic, 1 hour lab to 1 hour didactic and 2 hours of lab. So essentially doubling the hours of lab so that there can be smaller groups broken up to do more hands-on activity within that course. That's kind of the gist of our changes.
Any questions? Okay, Michelle?
Before I read the first motion, Allison, I'm sorry, I didn't catch. Is it objective number 2 or number 4 that you were? updating
Is number 4.
for clinical reasoning and clinical judgment.
Correct.
Okay, thank you. Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from the University of Kansas to change program objective number 4, replace clinical reasoning with clinical judgment.
This is Michelle Berdishaw. I'll move.
And this is Dee Bonenbless, and I will second that motion.
Thanks, Dee. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from the University of Kansas to change NURS 331 basic assessment and clinical skills from 2 credit hour didactic and 1 credit hour of lab to 1 credit hour didactic, 2 credit hours of lab.
This is Christina. I'll make that motion.
Thank you.
This is Michelle. I'll second.
Thank you. Any discussion? All in favor signify by saying yes.
Yes.
Any opposed signify by saying no. Any abstentions? Motion carries. Okay.
Thank you.
Thank you very much. Pittsburgh State University. Amy, are you presenting this one or?
No, I believe Dr. Giefer will be joining us for this one.
Great.
I'm assuming you're on with Karen Johnson.
Yes.
Okay. I've added Karen. I'm waiting for her to come over. There we go. I'm not seeing Cheryl Gafer.
Karen, it's Dr. Join us too, or is it just you?
Whoop. Carol, you're coming across like a robot. Or Carol, you're coming across like a robot.
Oh.
Karen, is Cheryl joining as well?
Yes, I think she is listening. Let me see.
Let me scroll through again. Maybe. Oh, I see now. It's a different name.
Oh.
It's C. Gaver. I see it now.
Okay, hi everyone. I can't figure out where my camera is. Anyway, we have 4 curriculum requests today. Can everyone hear me? Can y'all hear me?
Very good.
Okay, we have 4 requests today and they are all actually very similar. So could I do them all as one request? The 4 courses that I'm requesting to convert from face-to-face to hybrid.
Sure, tell us about them. Yeah.
Okay. The reason we're doing this is really related to what we learned during online teaching during the pandemic and following the pandemic. We realized by looking at our student learning outcomes that our final course grades remain very similar. we had the same number of students in remediation. And then finally, our overall ATI pass rates remain similar. The request came from the faculty, and in looking at student feedback, we realized that our students enjoyed the flexibility of the online learning environment. And looking at a very recent cohort of pathophysiology students, we learned that 96% of these students have an area code outside of our 620 area code. So it has helped that they are, if they would be able to take the course online, on each of these courses, we are planning to have them come to class for face-to-face testing in our computer lab using, the proctored environment with the Respondus lockdown browser. We're not planning to change any of that. And so the courses are Nursing 390, Pathophysiologic Basis of Nursing, and the second course is Evidence-Based Research, which has been a night class. The students will still come to class for their poster presentations of their research proposals. In the end, they'll come to class come to campus for their testing, but it will allow them to have the flexibility of some online learning in addition to the rest of their curriculum that we offer. The third course is Health Promotion and Disease Prevention. This course, along with pathophysiology, are courses that can be taken prior to being admitted to our nursing upper division nursing courses. So we have a lot of students that may not get admitted to our program with the first application. And so they are finishing up science courses or, developmental psych or who knows what. And a lot of students may not live on campus. They may be, in Kansas, or they may be in Oklahoma or Missouri. So we felt that this course would be great to continue on online. However, we will continue to test in the face-to-face format for health promotion. And then the fourth course is our Nursing the Psychiatric Mental Health Client. And with this course, we're planning to teach 70% of it face-to-face, about 30% online. And again, the students will come to campus for testing in our proctored computer lab using Respondus. So those are our 4 requests related to student feedback, and they were actually brought to me by the faculty.
Thank you, Dr. Giefer. Any questions?
This is Dee Bonenblest, and I just want to clarify that on the last one that you presented, there won't interfere with clinical in any method.
No, clinical will still occur in the usual format. It's, nowadays, psychiatric mental health clinical sites are kind of hard to get into unless you reduce the student numbers. We have actually hired an extra faculty for this course, and we will be teaching in a 1 to 5 or 6 clinical format. And we use clinical sites in Joplin, Missouri, Nevada, Missouri, and a senior behavioral health site in Girard, Kansas.
Thank you.
Thank you.
Any other questions? Okay, Michelle, what do you have for us?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Pittsburgh State University BSN program changing NURS 390, NURS 482, NURS 265, and NURS 470 from face-to-face to hybrid courses.
This is Dee Bonenblest, and I will make that motion.
Thank you. This is Christina Rudisill, and I'll second that motion.
Thanks, Christina. Any discussion? All in favor signify by saying yes.
Yes.
Yes. Any opposed signify by saying no. Any abstentions?
This is Amy Hyde. I will abstain.
Motion passes. Thank you, Dr.
Thank you.
Okay, Neosho County Community College.
Yeah, we should have Laura Mallet.
I don't know what's going on with your mic, Carol. You may want to unplug and plug it back in if you can.
Yeah, I'll be there.
And in the meantime, we have Laura Mallet. There we are.
I also think Pam Kovolt.
Pam
She's on the list.
Gotcha.
And Pam Colwell is here also.
She should be on the way.
I'm actually here, but I don't know why my camera is not working, but it is not. So with your permission, I will give a brief overview, and then any questions you might have, I'll have you direct to Laura, because Laura led the faculty in this initiative. When we revised our curriculum to a concept-based curriculum, each of the 4 nursing semesters had a course that we called Professional Nursing Concepts. These courses had fewer credit hours because they had fewer concepts in these courses. Over the last 5 years that we've implemented the curriculum, we've noticed that because these courses have fewer credit hours, the tests are scheduled farther apart. And when students perhaps do not do well on the first exam and then sit and look at that score for a long period of time, there became some negativity, which essentially is contagious, as you can imagine. And so kind of led to other students being negative and what have you. So the faculty got together and discussed what can we do to improve this for the students. And the outcome was combine the professional nursing concept courses on each level to one course and offer it in the last semester of each level. So what we're asking to do is to combine NURS 115 Professional Nursing Concepts 1 and NURS 125 Professional Nursing Concepts 2 to be merged into NURS 127 Professional Nursing Concepts Level 1. And then essentially we're asking for the very same thing on the second level, just different course numbers, if that makes sense. It doesn't change the content of the course whatsoever. They're being merged. So the concepts are the same, the outcomes are the same, they're just being merged. And we actually found as we work toward this that it does even out the course load in the semesters a little bit better.
Any questions? Okay, Michelle?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Neosho County Community College to merge NURS 115 and NURS 125, 2 and 1 credit hours respectively into NURS 127 Professional Nursing Concepts, Level 1 for 3 credit hours.
This is Amy Hyde. I'll make the motion.
Amy.
This is Christina Rudisell. I'll second.
Thanks, Christina. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. Any abstentions? Motion carries.
I have a motion for the NURS 235. Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Neosho County Community College to merge NURS 235 1 credit hour and NURS 245 1 credit hour into NURS 247 Professional Nursing Concepts Level 2 for 2 credit hours.
This is Michelle Burdishaw. I'll make that motion.
And this is Dee, and I will second that motion.
Thanks, Dee. Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Motion carries.
Thank you very much.
Thank you. Have a great day.
You too.
University of St. Mary's. I think there's
That one is mine that I'll present for. So our graduate program director is on vacation. So we have two motions or two requests. And the first one is they're both related to our MSN FNP program. And the first motion is to propose to move their the nurse practitioners theory courses to the online format. And with our other MSN students, these we were running double courses, and for our MSN educator program and admin, as well as the FNP. And so this is to approve our budget, but also provide flexibility within that first year. We're asking for this to start now. In this situation, we would not have an on-ground format for those theory courses. And so that is our first proposal. Our second proposal is to request an online format for the practicum courses for the nurse practitioner, but also continue with an on-ground format. So provide students an opportunity to either, due to flexibility, to whether they'd want to go online versus on ground. They would have to make that decision upon entry to the program. And we're hoping that this would increase our enrollment, because we're typically around 7 to 10 and not up to our 25 number that we're allowed. So we're hoping that this will increase student enrollment and kind of grow our program a little bit more. So any questions? And this would start, the FNPs would start in 2023 of the fall as far as the practicum courses online. So.
Thanks, Michelle. Michelle Brown.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from University of St. Mary to change theory courses from face-to-face to an online platform for MS in FNP students.
This is Christina Rudisell. I'll make that motion.
And this is Dee Bonenbless, and I will second that motion.
Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions?
I'll abstain.
Motion carries. Thank you.
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from University of St. Mary to expand the current on-ground MS and FNP program, provide to an online option with a start date of fall of 2023.
This is Dee Bonenbless, and I will make that motion.
Thank you.
Sorry, Amy, was that you?
Well, Dee and I both did, so I can, if she wants to make the motion, I'll be happy to second.
Okay, that sounds good. That sounds good. My computer might have glitched a second. I apologize. So sounds good. Any discussion? All in favor signify by saying yes.
Yes.
Yes. Yes.
Any opposed signify by saying no. And any abstentions?
I will abstain.
All right, motion carries. Thank you. And we have one more for our new business, Washburn Institute of Technology.
And Colton, this one should be Pam Masters. Do I sound better?
Yes. Much better, Carol. Thank you.
All right.
Good morning.
Good morning.
Can you hear me?
Yes.
Okay, I'm Pam Masters, and my request is actually I submitted it for 4 courses, and I don't know if I have to submit this next time. I wanted to add a 5th course to that, if possible. Can I make a modification at this time? Is that
I think we would typically ask that you submit that for the next meeting.
okay? All right, I will do that. So our request is that we change 4 of our courses: PNS 121, PNS 145, PNS 232, and PNS 235 from in-person to hybrid mode of delivery. That is our strategies of success, our pharmacology, our care of aging adults, and our mental health courses. They would have in-person lab time, presentations, and then also their testing would be proctored and also use the Respondus lockdown browser that we have in place already. And that is our clinical courses are also separate courses. They're not included in this. So any questions?
Okay, Michelle?
Is there a committee member that would like to make the following motion? I move to approve the major curriculum change request from Washburn Institute of Technology to change a PNS 121, PNS 145, PNS 232, and PNS 235 from in-person to hybrid courses.
This is Christina Rudisill. I'll make that motion.
And this is Michelle Berdishall, second.
Any discussion? All in favor signify by saying yes.
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 Any opposed signify by saying no. And any abstentions? Okay, motion carries. Thank you,
Thank
Pam.
you.
All right. We'll move on to our unfinished business, the annual report update. Carol?
Yeah, this is Carol Moreland. And Janelle has not got the information back from NCSBN yet, so I don't think they're totally done with it. So it would be our suggestion that we take this forward to September's agenda, if that's okay with the committee.
Yes, that sounds great. Thank you. We'll table that until September.
Okay.
How about English proficiency exams?
Yeah, on page 193 in your packet, if you remember right, we brought this last time because I have been approached by the Hospital Association. Evidently, there's some interest out there in us having more than just the TOEFL for a test for English proficiency. And so on page 193, Janelle at the top has put the regulation that kind of talks about English proficiency testing, and you will see that it talks about TOEFL, but it says or similar exams as approved by the board. So we brought this International English Language Testing System test as maybe another option that the board might think of approving. And if you look actually on page 195 in your packet, you will see that there are quite a few boards of nursing that do use this one. So we wouldn't kind of be out there by ourselves. But if just kind of refresh with you on the TOEFL, you know, there's 4 different things. There's reading, writing, speaking, and listening. Okay, in the chart that she's got you where it says reading 19, writing 20, speaking 20, and listening 20, those are the minimum scores in each of those areas. So our TOEFL is broken down by minimal scores in each area. So if you're interested in approving this one, you know, you certainly can approve it, but you're also going to have to set some minimum scores that they're going to have to, you know, score. You could have a total overall score, you know, and you'll see 79 to 93 is the range for the TOEFL that we have. But again, they have to meet the minimum in each of those 4 areas in order to be approved by KSBN in their English proficiency. So you see that would equate to about 6.5 on this international English language. And then she's also broken it down here by the bottom. You know, 19 would fall under 6.5. Writing, 20 would be under 5.5. Speaking, 20 on the TOEFL would equate to about 6.5. And listening, 20 on the TOEFL would equate to 6.5. And most of the common scores is 6.5 overall with a minimum speaking score of 7 and no sub-score below 6. So you'll see a little bit more about what the other scores are for the other boards of nursing on page 194. So this would just be another option other than TOEFL. Someone that is educated in a foreign country and not educated in English.
This is Christina Rudisell. Carol, do we need to, so if we were to accept this additional testing platform, would we need to move this then to the September board meeting and create a committee to determine what the base is for passing?
I think it's up to the committee how they want to handle this. But I would suggest that you have minimum scores for each of those 4 areas, because we have seen people that score very high in one area but low in another area. Overall, they're okay, but they would be very low in that one area, probably lower than you might want.
Yeah.
So is that a conversation that we want to think about, and or do we to establish the standard, the scores?
I mean, this is just my opinion, but it looks like Janelle has done pretty considerable research on who's doing what. And it looks kind of everybody that's, well, the 24 states that are using them are saying a 6.5 minimal overall score, but also that 10 are using it, the 6.5 for a speaking score and things like that. And I mean, if that's kind of the equivalent, I would be okay with saying that they would have to meet a 6.5 for each section. But that's just, I'm just a very small fish in a large pond.
So even in the writing section?
Oh, that's the one where it was 5.5, wasn't it?
Yeah.
Yeah, yeah. So we could do 6.5, 5.5, 6.5, and 6.5.
Okay.
Per Janelle's suggestion, based off of her research.
And students could take one or the other, correct? So they would have like an option. This is just increasing their options.
Yes, that is correct. Yeah.
Well, I would support that recommendation if Christina, if you're okay with that, should we?
Well, I mean, we can even make a motion just so we can have more discussion about it at the very least. So Christina Rudisell, I'll make a motion that we accept the IELTS with a minimum score in reading of 6.5, a minimum score in writing of 5.5, a minimum score in speaking of 6.5, and a minimum score of listening of 6.5.
This is Dee Bonenbless, and I will second that motion.
Thanks, Dee. Any discussion?
In the motion, do we, and you may have already done this, but do we need to clarify that the overall score, what we would recommend the overall score to be?
Yeah, the overall score, I believe, was a 6.5, if I'm reading that correctly.
Okay.
Yeah.
Yeah.
Okay. Then I second.
So I think we have a motion and a second. Do we want to amend the motion to include that overall score?
Yes, I would like to amend the emotion. I did not sleep well last night. I apologize. I would like to amend the motion to add an overall score of 6.5.
Dee, are you still comfortable with that?
Yeah, I just want to clarify then. So on the TOEFL, and Carol, maybe you can help me. We have minimal scores, but not an overall, correct?
This is Carol Moreland. I believe we have an overall. However, what we look at is these minimum scores in 4 of the areas. We tell them that they have to meet those minimum scores in each of those areas.
Right.
So we actually look at the minimum scores in the 4 areas much more than the overall.
Right. Okay. I wanted to make sure we were clear in that when we look at both of these, that we would be looking at the the minimal scores and not lead somebody down the path of thinking they can go either or.
Okay.
Good idea. Okay.
So if we're consistent with the TOEFL with minimal scores, I wonder if we should be consistent with minimal scores for the IELTS band.
Well, I think, I don't have to look some up.
So you're saying having a preferred score, which was our, 6.5 in reading, 5.5 in writing, and 6.5 in speaking and listening. But then there would be a minimum score. Is that what you're saying?
No, the current regulations read, if I'm understanding you correctly, Dee, she's asking for the consistency, because right now we say the following scores for the TOEFL exam, and we have our minimum scores, and underneath that it says each area must meet the minimum requirement. So if we're going to do this, I think what Dee is suggesting is we would have the TOEFL or the IELTS exam, and then the minimum scores listed, and then underneath each area must meet the minimum requirement. So it doesn't matter what their overall score is. They have to meet the minimum requirements in each section. Am I understanding you correctly, Dee?
Yes, I just think that could confuse a student, because we have had students, as Carol indicated, that their overall score is good, but their minimal scores in each area may not. Was that the way you indicated that too, Carol?
Yes, that is correct. Yeah.
So if that's the case, then we would need to amend the motion again of removing the original amendment, if that's what we wanted to do.
Christina, would you like to amend the motion back to the original?
Yeah, let's just erase that line, Michelle. Officially, I would like to amend the motion to remove the amendment of the original motion.
Dee, are you comfortable seconding that?
Yes, I am comfortable seconding that motion.
Well, I appreciate the discussion and the clarification. So that's good that we worked through that. So any other discussion? Okay, all in favor signify by saying yes.
Yes.
Any opposed signify by saying no. And any abstentions? Motion carries. Okay. Our legal interpretation of the PN regulations for faculty preceptor qualifications.
Yes, this is Carol Moreland, and you'll remember at the last meeting, it was brought up that some of the PN programs are using preceptors. And so it was also brought up that our regulations do not specify that the PN programs can use preceptors. So I was asked to talk to our legal counsel and understand better, because I had understood ever since I was at the Board of Nursing that PN programs could not have preceptors because it did not say so in our regulation. And if you look at our regulation, which we're talking about 60-2-103, that is the one that talks about faculty and preceptor qualifications. Preceptors are only discussed under A, which is the professional nursing programs, which would be your RN programs, right? If you go down to B, the practical nursing programs, preceptors are not discussed in there. So I did talk to Charles, and we have to have authority for what we can do. And right now we don't have the authority to have preceptors in PN programs. The fact that it's not listed there does not mean that you can do it. That's not how the Nurse Practice Act is written. So the legal interpretation is that no, preceptors should not be used in the PN programs. Now, I think you have the option, if you want to do that, of revising that regulation. That's what it would take. Again, it's up to you. But the way it's written right now, no, they cannot use preceptors in the PN program. And then the second question that I guess I have for the committee is we do have several PN programs that are using preceptors. I asked Janelle, and from what she could tell from site visits and stuff like that, probably around 7. So my question for your consideration and some direction is, if they cannot do it, and that means that they are really not meeting our requirements, how much time do we give them to get into compliance? How do you want us to handle those ones that are not? I guess that's the question. And Charles is on. I don't know if you want to say anything in addition to what I said, Charles.
No, I think you covered it. In section B, it doesn't provide authority for preceptors. In section A, it specifically provides authority, and in section B, it's silent, or it doesn't mention preceptors at all. And so in statutory interpretation and regulation interpretation, if something is silent or it's not there, then it doesn't exist. So it has to be specifically referenced to provide the authority. So otherwise, I think you captured it, Carol.
This is Christina Rudisell. I had a question regarding that then. So is our option just to say you have to get in compliance within X amount of date, or is there an option to add the ability for PN programs to utilize preceptors? I don't know that.
This is Charles. You could either revise the regulation to add that to section B as well, or you can provide, it would be, I guess, up to the board to provide a reasonable time for those groups to get into compliance. It'd be up to your discretion.
Thank you for that clarification.
So Carol, my understanding is, this is Juliana. My understanding is it would take us a little while to change section B. And so that would be my question, is if we changed it to allow the preceptors, what happens during that interim time when it's truly not in effect yet? We don't have the regulation to support the direction that we want to go.
And this is Carol, and just to let you know, to revise a regulation, I would say probably 6 months, and if that flies through everything right. It's kind of a slow process. It sounds really simple, but I'm telling you, it doesn't quite move like you think it probably should all the time. So just to kind of let you know, that's probably what you would be looking at.
So that would be best case scenario, Carol, 6 months.
I would say so, yes.
So if we gave those 7 programs a year to be in compliance, is that too long? I'm just thinking about the challenges of programs finding faculty and qualified faculty, and some programs are having challenges as far as being able to actually admit more students because of the lack of faculty. I don't know, my thoughts would be a year as you're trying to change the regulation.
That would make sense. This is Juliana again. I guess my concern with that is if we were to tell them they had to be compliant within a year and then they changed their program and we changed the regulation with it. I mean, could we issue a letter that we are trying to change the regulation, but notification that they are currently out of compliance, and maybe not put a date of expected compliance? I don't know, or maybe we're opening ourselves up with that.
Because there's a possibility that it may not get changed, right? So.
True.
This is Carol. Just to let you know, if you are going down the path of revising the regulation, what would happen is I would work on it, but that would have to come back in September for the board to look at and say, yes, we're okay with this. We want you to start it through the approval process. It's not something that I can do without the board seeing it. So it would come back in September, and then if they're okay with it, then it would actually start through the approval process. I'll let you know.
So the 6 months doesn't start at least until September.
Right.
Yeah.
Yeah. Carol, is there a reason that it was not added for practical nursing, just historically? Are you aware of anything?
Well, okay, I've been at the board since 2010, and that was a question I asked when I started. What I was told, since this was the very basic entry for nursing, that it was really felt very strongly that they needed to be with faculty and not with a preceptor. I mean, we all know that not every practicing nurse has the best practice that you would want maybe students to pick up on. I know that everybody tries really hard to get wonderful preceptors and stuff like that, but you are kind of giving away some of that teaching and stuff like that to the preceptor when the student's with them. So that's how it was explained to me, is the board always felt like it was better to have them with a faculty. Now, you know that you may have changed in how you believe that, but that's the history as I know it.
Because we could even add in the regulation, I don't know if this would be, may not have a PM program, but that they're at least with an ADN per nurse or a BSN, or is that as a preceptor? I know, Christina, you have got a PM program. Is that reasonable, or is that?
Well, I mean, for my adjuncts, I won't hire anything lower than a BSN for adjuncts. And I personally, we don't use preceptors. We never have. So, but I do know that there's been a lot of concern at the KCP&E meeting and different people that have reached out stating, you know, it's like we really heavily rely on preceptors because of the location of their programs. You know, it's kind of like what you said, Michelle, is it's incredibly difficult to find faculty. And my concern is twofold. I certainly understand where the board is coming from historically. I think I would have that same concern. However, how negatively are we going to affect those outlying schools that those communities heavily rely on to produce new nurses if we force compliance? Does that make sense? So I'm kind of thinking of the other side too. I certainly understand and I would agree, you know, that would be a concern, but and honestly, Michelle, I don't know that it would really matter if it was an ADN or a BSN or, you know, I mean, bad habits are bad habits and, you know, and it happens at all levels. That's the reality of the situation, you know? But yeah, I mean, it's a difficult, I don't know what the right answer is. My biggest concern though, is we're hurting for nurses so badly right now. And my fear is if we remove the preceptors for those that are using them, you know, how is that going to affect that community overall and their nursing shortage? So that's where my head goes.
Dee, do you have thoughts?
Yeah, I was just getting ready to chime in. This is Dee Bonenblust, and you know, and I am listening to all this discussion, and I do hear, I hear both sides. Excuse me, but I sort of lend myself to, at some point, I think initially, I would feel comfortable at least issuing a letter saying, I mean, because we are out of compliance. I mean, we've got a legal stance here that's clearly telling us that we're out of compliance. So I feel like we at least need to address that. I like the idea of setting a limit on it, giving all of our programs an opportunity to make a change. I mean, here again, it's up to interpretation. As Carol indicated, that some programs have interpreted it in that direction. So I think we do need to allow our programs to have an opportunity to change. But I do also agree that down the road, here again, it's not going to happen very quickly. I would be concerned about letting these programs know, hey, we're aware that you're out of compliance, but we're going to start the process, and it might be a year and a half before we actually get into compliance. That would be, I'm thinking about, we would not do that with our students. And so I think from a board's or a committee's point of view, we would want to recommend something like that onto the board. So those are my thoughts.
Thank you, Dee. Amy, I don't know if you've weighed in or not. Do you have thoughts?
So I think it would be good for us to take a little chance to look at this between now and September. And I don't see why it should be different for the PN programs versus the BSN and ADN programs as far as the regulations and allowing preceptors, because we have them, and I can't remember the exact percent other than the capstone course. We allow it in the other programs. I think if we keep it consistent across all of our programs with training, requirements for orientation, they sign a document so we know what courses, and students should be evaluating the preceptors. And I think that's how we do it in all of our BSN programs and ADN programs. So I think as long as it's consistent across them, I think we're exactly what Christina and Michelle have said. We have a shortage of nursing faculty across the US, and we don't want to put any extra burden on any program in Kansas that's offering a good program. And I think we've moved forward a lot, as Carol said, historically, with preceptors and the training of preceptors. I don't think we used to have that in our programs at any level. And now it's a requirement for those orientations, both for KSBN approval and for our accrediting bodies. So I think if we really look at it and make it consistent across all of those, I don't think there would be a problem, but that's my thoughts.
Well, thank you very much. I appreciate what all you have added. If I am hearing correctly from all of us, I think we would like to potentially see a proposed regulation change in September, Carol. So maybe if that's something you can start drafting, so we could take a look at what that might look like. And then as far as, I really appreciate what Dee said, and then also taking into account the nursing shortage and all of the reasons that Michelle, Amy, Christina brought up. Maybe we just notify these 7 schools that they are out of compliance, and hopefully they've listened to the robust conversation that we've had here today, and we'll inform them that they currently are out of compliance.
So this is Carol. If I can just clarify, are you wanting basically the same content about preceptors that is in the professional nursing programs in our regulation? Are you wanting that very same content then in the practical nursing? Is that because basically we say that the requirement is be licensed as a registered professional nurse in the state in which the individual is currently practicing nursing. Actually with the multi-state, we have a little opportunity here to revise that language probably. And then secondly, complete a preceptor orientation that includes information about the pedagogical aspects of the student-preceptor relationship and course information. Are you wanting that very same content then put under practical nursing? Is that what you're wanting?
Yes.
Okay, thank you.
And then do we want to, so in that letter of non-compliance, are we wanting to put a deadline of, because I don't know that these schools, they've already admitted students for the fall. I don't know that they're going to have time between now and then. I live in KC Metro and I'm having a hard time finding enough adjuncts. So, I don't know if they're going to have enough time to, what I'm saying is they will probably have to deny students if we don't give them some grace.
Michelle, I think you might have suggested a year. Is that?
I suggested a year. I don't know, was it Dee that said a year and a half, or, I think a year is reasonable.
Yeah, I think a year gives them time at least. And and if we're lucky and everything gets approved and we're able to move forward within that year, okay, great. If not, they at least have some time to find adjuncts.
And I don't see, if we ended up getting the regulation approved, I don't see that hurting programs that already became compliant. So I think it would only just be a bonus. So
exactly, I would agree.
This is Charles and Cheers again. Carol, if you would like me to, I can work with you on maybe some language to put in the letters.
That's a very good idea. Thank you. If that's okay with the committee, I'll work with Charles to get the language. Okay.
Yes.
Absolutely.
Thank you, Charles.
Carol, can this just be direction from the committee, or do you need a motion for these things?
I don't think it requires a motion.
Yeah, I don't think so.
Great.
All right. Thank you. Good, healthy discussion. I appreciate that.
Can I ask a question, Juliana?
Yes, please. Sorry, Carol.
I presume you're going to discuss this at the board meeting tomorrow and the discussion that we had here.
We certainly can share this. Yes. Yes.
Okay. Okay. Thank you.
Great. Yeah, absolutely. Okay. I'll make note of that. Okay, moving on to the 2022 nursing and MHT program site visit schedule.
Yeah, this is Carol, and that's on page 196 in your packet. They've had a very busy first part of 2022. So it doesn't appear to be quite as bad in the fall, but I think Janelle has people lined up for all the site visits that she currently has scheduled. So I think we're probably okay through the end of 2022. And then 2023, she has on page 197, looks to be maybe a little bit lighter than this year. So those, and she doesn't really have too many dates solidified yet for that.
Okay, sounds great. Thank you for that information. So now we're moving on to the petition for permission to test and retest summary from March through May. I think there were 7.
Yeah,
Go ahead, Carol.
that's actually on page 198 in your packet. Pretty cut and dried, you know, how we normally do it. I don't think there were any questions on any of them or anything like that.
Okay, is there a motion for those?
Is there a committee member that would like to make the following motion? I move to approve the petition for permission to test retest summary from March 1st, 2022 through May 27th, 2022, which includes Jamie Lane, Karina Vasquez, Serena Johnson, Morgan Cozort, Gabriela Torres, Lauren Harrington.
This is Amy Hyde. I will make the motion.
This is Christina Rudisell. I'll second.
Thank you very much. Any discussion? All in favor signify by saying yes.
Yes. Yes.
Anyone opposed signify by saying no. Any abstentions? Motion carries. Okay. What agenda items for September? I know that we talked earlier. We're gonna re-look at, was it Rasmussen University? Is that right? We're gonna look at theirs again in September as their site visit report, and they had some follow-up to give to us. Anything else? And then obviously we wanna take a look at that regulation for the adding preceptors for the PN programs. Okay. Well, I appreciate everyone's participation today. I know it's a long morning, so thanks for hanging in there with us. I hope you all have a great rest of the month and a happy 4th of July, and we'll talk to you in September.